Well, welcome everybody to another Lady Leaders of Dentistry webinar. We have got a really important and I think prevalent topic that I find, I don't know, Ash, you can tell me, but I feel like talking all things hygiene department is a ton of my calls when I talk to clients about how do I get my hygienist motivated? How do I get them to produce this magical 3.3 times their pay number? How do I incentivize them right or motivate them right or whatever to get them to want to do this? So I thought to myself, like, knowing that it's a topic that people just keep wanting to talk about, I thought, well, who better to have on than the most amazing hygienist I know, which is Amy Merrihew. She has been our lead hygienist for the offices for a long time. I don't know, several years now, but she's actually been with me for, we found out, like we just did the math, 17 years.
Wow, that's amazing. Congratulations.
Yeah.
To both of you.
I know. Mostly like, how did she do it, right, Ashley?
That was my question.
She knows how to tune out at just the right times, right? Still shake her head. But yeah, what I thought to myself was like, knowing that Amy, and I'll kind of give you a little bit more of her story in a second, that from my point of view, but she is someone that, considering, how long have you been a hygienist, Amy?
Almost 24 years.
So almost 24 years. And she's still like killing it, crushing it, and super passionate about what she does. So I'll let her kind of first just kind of tell us a little bit about, for everybody who's listening, tell everyone a little bit about you first.
So I have been practicing about 24 years, 17 of them with Dr. Casmel. I did have ownership in a practice for a short time, and kind of the partnership sort of broke apart. And so I feel like I have a pretty good understanding of like the business side of things. Yeah, I've morphed from the typical like 4 bite wings, bloody prophy hygienist to kind of what I am able to achieve now. And it's been just a journey, but yeah. I love that we just keep growing and we keep changing, and it's just been fun. And I think it's keeping me like loving the field, and that's why I'm still doing it, because I still just love it.
Mm-hmm. Yeah. Well, sorry. Well, what do you find, like, what are for you in those years, and even say in the last few years, what have been the biggest challenges growing that much and still loving it? Like, what have been some of the biggest challenges you think you're facing?
Well, I think I can speak for all hygienists. I think time is always the biggest challenge. Thinking that I don't have enough time to add this or that, just thinking that, oh my gosh, I'm already doing so much. There's no way that we can make this work. So I think I'm getting in my own way, thinking that I can't make things happen. And then I think just fear of change and not wanting to implement something until I'm really good at it. But the only way to get good at things is to like jump in and start trying it. And that's been a big one for me, is just I have to be uncomfortable to grow. So that's been huge. I've been uncomfortable a lot, but I usually fail forward, and that's a good thing. And then I think we have found too, just like with all the changes in practice through the years, like the culture of the office itself, and just everybody being on the same page and believing in our mission, having the same core values. I think that's a huge part of it. Like if everybody is kind of on board, there's no limit to what the office can do.
That's awesome. I love it.
That's a really good answer. I'm like, preach, yes. Well, and what I want to say about Amy and Ashley, I'm like, I think you even know this, because like we were together even when I joined, and you knew me kind of in the DSI kind of space. Like Amy was one of the first hygienists that was a 6-figure. She made a 6-figure salary and was still producing 3.3 times her pay. I remember Jake kept rerunning everything and was like, I don't get it. And I was like, I know, like, like she really is She really does make a 6-figure salary, but here's the thing, is she brings every bit of value to that position. She produces 3.3 times her pay. She's a treatment co-diagnoser like you wouldn't believe. So what comes out of her operatories can be, I'm not kidding. Like, she talks patients into changing their bites like nobody's business. And because she cares, she's not selling anything. And the thing is like she really does. And I think even since, we started, like, she's moved from doing $1,600 days to now she does, literally just last week, I think she had a $3,200 day as a hygienist. So, when I kind of talk about, like, Jake lovingly, and I joke, like, he jokes that she's a beast.
Oh.
And I told him that I don't think women like to be called a beast, but he was like, it's a compliment. So she really is, like, listening to that. If doctors are sitting there thinking like people don't change, people can't grow, they really can. But we're going to kind of, now dive into some of the things, maybe Ashley, you and I have heard a lot about the reasons why people can't do what Amy does. And we're going to try to dissect out maybe some really tactical things for how they can do these things.
Sure.
So knowing that is kind of the baseline, what are some of the things, Amy, that you do to help yourself pretty consistently hit at least $2,000 days?
I think one of the biggest things that we have implemented is our like prepping for the day, like going into the day with intention, and like past appointments, taking great notes about like conversations that were had, areas that have been monitored, and go into that day knowing like I need to take a PA here of this tooth, or I need to take the intraoral photo of number 15 with that huge amalgam. I need to show the patient that picture again because doctor said that one's going to need a crown. Just really like looking at everybody's chart, knowing like they had 4mm pockets with bleeding last time. Maybe I could add laser today, or maybe I need to do localized scaling and root planing in that area. I can do that in that morning prep and go in knowing that I'm going to talk to this patient about this. I'm going to talk to this patient about this. There's so much on the front end that you can do to prepare yourself that if you wait until that appointment to try to figure out what you're going to do, I think you leave so much just on the table that you're not going to have time to do it in that moment, and that's where you lose that opportunity. So I think that's one of the biggest things. And then just making it so easy to add those things. Like we used to have to get up to go get stuff to do sealants. We'd have to leave our room and go grab everything and then come back. Now everything is within my arm's reach. I have a laser by my side. I have my second drawer down has all my sealant stuff. It's got Aura kicks for localized scaling. It's got a syringe. It's got topical. It's got everything I need, that if right in that moment I decide that I want to add that, it's all right there. And backing up to the morning prep, I already, if I know there's this potential patient that I can add the 1 to 3 teeth of scaling and root planing, I let the front office know, like, hey guys, this one I might be adding. They go ahead and print off a treatment plan and they have that ready. Or, I actually get it kind of ready and then I have them double check it before they print it to make sure that it's accurate. But it's there, like all I have to do is say, here's what today's portion will be, and they sign off and we're good to go. So I just think just going into the day with intention, that hands down has probably been the biggest part of adding.
Sounds like, like we talk about this all the time, of course, too, but it sounds like there's some amazing systems in there, right? Your systems for the and I'm assuming this is assisted hygiene because your assistants are setting up at least the rooms and making sure that you have all the tools that you need right there for you, so you're not having to leave. It's all about those systems.
Well, and here's what I will say too, because I get the question all the time of like, how long do you give them? Well, one, I'm a big believer of like they get the full 60 minutes for a recall visit. So that allows them the time that if they have a 1 to 3 teeth quad, they can actually add that in more successfully. Some people give the 40 minutes and things like that. And I'm not sitting here saying one's right, one's wrong. It's more so, I think she can do as much value as she can because she has the time. But we're going to even dive into like, what does she do with her time? Because she gets often like, how can you possibly do that? Because yes, our assistants will run, bag all the instruments. Sometimes they restock, but to be completely honest, each hygienist is responsible for their own room at the end of the day. Yeah. So she's doing this pretty well. That's what I was going to say is I'm going to break down with her appointments. Because I mean, I will say 10 years ago, I remember when we started having this conversation and she was like, this isn't going to happen. Like, you're so cute. Like, this is not going to happen. There, Dr. Casmel, like, calm down. And I'm like, I think we can do it. Like, I think, like, let's work together and figure it out. But the cool thing is you can give her suggestions and then she'll take them, you know, much further and way better than ever I could. So we're going to talk through, like, how does she actually add those adjunctives? So, you know, she kind of discussed one of the big things we changed was ensuring they had the time to add adjunctives and then having everything possible within arm's reach so that it was super easy, you know, intraoral cameras and all the stuff that she said. But, you know, go ahead.
I was just going to say, it's a whole team approach too. Like, I am not sitting here being like, I added this all myself. Like, I think that like even the front office needs some credit because they have awesome insurance breakdowns with all the frequencies, age limits, everything that I need to know about so that I can then at least tell the patient like, hey, we need to do this and this and this. Your insurance isn't going to cover this, but I do recommend it. You know, like those conversations can be had. They're going to know they're having a copay for whatever I'm offering. They say yes or they say no, and at least I offered it. But I do think that the insurance verification and those breakdowns are huge because if they're easy to go and read and find that information, like in my morning huddle prepping or if I'm doing it the day before or whatever, I mean, I have all the answers right there. I don't have to go to the front and be like, hey, can you check and see if this patient is due for a pano or whatever. And that's the other thing, like on those frequencies, you know, making sure that you're taking advantage of, you know, they haven't had a pano in 6 years. They had an FMX 3 years ago or whatever, but they're eligible for, you know, another x-ray. Like, let's do it. Like, we just found, you know, stones in the carotid artery, you know, on a patient that like, we wouldn't have never seen that. And I don't think their medical doctor would have seen it. Like, there's so many things that like we're missing if we're not using all of our tools. So.
Such a good point. Like, actually, you're right. Like, once again, doesn't it all come down to preparation? Like, like I'm sitting here thinking as she was saying that, I'm like, it is a whole team approach, but it starts with the first phone call, the great breakdown, really good insurance information put into those charts. The hygienist sitting and doing a morning huddle prep, which by the way, Ashley, we're going to put, we have 2 versions for morning huddle preps, depending on which one works better for our hygienists. So we'll make sure to post the morning huddle preps. Amy is so efficient that she combined her morning huddle with her end of day.
And my checklist, it's all in one sheet.
I love it. Love it.
Yeah. So we're going to post that because, yeah, I think the point Amy's trying to say is like, the level of preparation makes the day. And I sometimes hear doctors who get super bent out of shape if their hygienists are coming 30 minutes early to prep or staying 30 minutes late. I'm like, you're right. You should be bent out of shape if you're not seeing a return on that investment of time. You should be. They're right. It is costly. In the grand scheme, I remember we ran the numbers her and I one time. It was like $7,000 extra in the course of a year or something. If they did that, but then nothing came of it. But if you listen to what Amy just said, because she takes that time, she's producing these $2,000-$3,000 days. To me, I'm like, it's well worth it if I have hygienists who are spending the time. You know, I'd rather spend the money on that side. So I think what we've kind of hammered home, and Amy likes such beautiful points, is preparation is kind of the crux. Like, that's the big thing for all of it. But once you're ready for your day, you've checked all your stuff, you know, your drawers are ready, you're ready kind of for whatever, you've got all the tools in the toolkit ready to go. Tell me, you know, what do your appointments look like? You know, when you're doing your first, you sit them down, your first assessment, like what has made the difference for you as you kind of are looking at those patients? Kind of break it down tactily for people.
I think one of the biggest things is the recall patients. We're trying to stick to like a 20-minute assessment. So it's like, yes, that's a big chunk of that appointment, but that's where all the
magic happens.
That's where the magic happens. That's where you really assess like all of their needs, not just their perio needs, because that's not all we should be talking about. We should be talking about, you know, if I found anything with the oral cancer screening, if I found anything, another big one, like we talked about with our exam sheets, is like just letting the doctor know, like, have you met this patient yet or not? Because we've had doctors go in and introduce them to a patient that they've done like 2 crowns on. So just giving them that info, that, and then, you know, pre-rinse, review medical history, maybe put the blood pressure cuff on when you're doing the x-rays, while, you know, just trying to be as streamlined and efficient as possible, get all of that information done. We usually will not do perio charting and x-rays on the same, or the perio charting like recorded one on the same visit. We'll kind of alternate visits. So once a year we'll do x-rays, once a year we'll do the full mouth perio chart. That's done. The intraoral photos are done. And then we actually take the time to drag those photos over and talk to the patient about what we're seeing. And a lot of times those photos speak for themselves. You don't even really have to say anything. The patient's like, what do I need to do about that? But I think taking the time to just let the patient know what you're seeing. You don't have to diagnose. I don't diagnose anything. I just usually will say, like, in this situation, the doctor will usually recommend a crown, or, you know, I am seeing a lot of wear. It looks like these teeth are starting to incline, you know, the wrong way. The forces aren't distributed correctly. Like, maybe we should look at an oral health scan and look at the bite. There's just so many things you can do in that assessment that need to be covered. And once that assessment's done, what we've decided is we're gonna let the doctor know, like, come in and we're ready for the exam. Don't wait till the end of the appointment. So we send a little note out, and we give the doctor like a timeout. We want you out of the room by this time. So say the appointment started at 10, I'm being at 10:20, and I tell the doctor timeout is 10:40 or whatever, you know. So they have a 20-minute window to hopefully wrap up whatever they're doing, to come in, do the exam, and then be out of my room. So then I can wrap up the appointment, get the treatment plan ready, kind of have that all gone over, get that next appointment scheduled. And in the, you know, the next 20-minute appointment, or 20-minute part of that 60-minute visit, I'm doing the instrumentation, the, you know, hand scaling, the Cavitron, you know, all of that. Doctor comes in wherever it fits, and then, you know, the flossing, the fluoride. We just try to wrap that all up in that last part. Mm-hmm. And we can even maybe have like a breakdown of like the 20-minute, like what's all included in that first 20-minute assessment. And we actually had kind of we made it an accountability goal to try to figure out, like, how can we get more done in that 20-minute assessment. And it was almost like a time tracking thing. Like, it's taking me this long to do this long to do this. And it was almost like this, like,
that's right.
Like trying to get it dialed in to where, like, we could actually get it all done. And it's amazing when you start being intentional about it, like how efficient you can be.
Mm-hmm. And I would say that that's been like a really monumental shift in our entire hygiene program, was like going in without even intentionality within the appointment. Because what happens, I think people just get into habits, and sometimes those habits just lead to complacency. And like you said, we're just leaving a lot of things on the table, where now when they're actually doing this 20-minute assessment, where they're going through this checklist of soft tissue, hard tissue, occlusion, missing teeth, you know, improving smile, chief complaint, like they're literally just working through this entire list in that first 20 minutes. Our perio conversions have gone up quite a bit since I mean, I don't know if you remember, Ashley, we were dismal. If anybody's sitting there thinking like, you know, and it was my fault. I mean, I didn't know really how to even talk about it with my hygienist, but, you know, we were in the teens, I think, Ashley. And,
Right.
you know, I was just telling her now, like truly in the last few years, just really being good about that first 20 minutes assessing their periodontal condition along with everything, really seeing the mouth as a whole has led them to increasing their perio percentages by like 30%. Um, and it's all just because they took the time to really, I think, assess everything as a whole, including the perio portion. So that first 20 minutes is that assessment part. The IO photos, like she said, you know, x-rays if they need them, perio charting, pulling the pictures forward and talking through what they're seeing. Then alerting the doctor that the assessment's done. That's when they know, the doctor knows, okay, the assessment and all that legwork, that's been done and it's been reviewed with the patient. The middle 20 minutes, because I think there was a question, Amy, too, that middle 20 minutes is when they actually do the hygiene specific portion of, if it was a 1110, they'll do that. What happens if you found out in the 20-minute assessment, Amy, we've got a couple 5mm pockets or bleeding? What do you do then for that middle 20 minutes?
I'll usually try to convert it to a same day localized scaling and root planing. Or if it's a 4-3-4-6, you know, I've got the Orachix in the drawer. We're going to go ahead and just try to convert that day. And usually we don't have to wait for the doctor. You know, they are, they trust us in the perio part of it. Like that's our area. They want us to just kind of have like the say in that. Like they kind of don't even touch that part. We just more or less help them with teeing up the treatment that needs to be done, but
Right.
They pretty much just bless whatever we're saying when it comes to the perio.
You own that zone.
Yes. And we did as a team kind of come up with our perio protocol. If it's this, then this is what's ideal in that appointment. If it's this, here's what it is. And you know, if it's the scaling with inflammation code, we're going to maybe even offer the laser bacterial reduction. You know, if it's the localized scaling, if they're a new patient, that one's a little bit easier because you have even a little longer. But even if you don't have, you know, the 90 minutes, if it's a recall patient, you can still get it done. You just have to be ready to like jump on it. And like I said before, usually I know those patients that I think are kind of borderline, that we've been talking about it in past visits, that I know when it's time to just like, okay, we're doing this today.
Mm-hmm. Well, and one question, it's funny, I was telling her in those conversations I had this morning already with a couple doctors about perio program, I said, one of the questions I got was like, okay, so what's the actual verbiage you use when you're sitting looking at a patient, you know in that assessment that you're like, shoot, I do have 2 quadrants of 1 to 3 teeth that I'm going to have to add if possible today. And I need to tell them, you know, I've got my treatment plan ready already. Because like you said, it was already in your room ready. What's the conversation you have?
So before I ever even start probing, I tell the patient, and I use a headset that I speak into, and it records it into Open Dental for me. So I just call out the numbers, and the patient hears them. And so before I even start, I let them know, like, I'm doing a periodontal assessment. This is just, you know, a screening for periodontal disease, which is a disease that affects the bone that surrounds your teeth. Good numbers, if you hear me say 1 to 3, that's healthy. If you hear 4, that's borderline, and 5 and above is actual periodontal disease. And so they hear, and then they're also hearing me say bleeding. And if I let them know too, also bleeding is an indication that there's active disease going on. And so as I'm going through and probing, they kind of get their scorecard right there. Like they know, like, ooh, this isn't good. And so I don't have to say much at the end other than they're like, what do we need to do? And that's when I'll have the conversation. I'll bring those pictures over. I'll show them if there's calculus on the bite wings, that's really an easy one, because you're just like, we need to get below the gum line and we need to clean that off. Or if there's just bone loss, we go over that. But just really, it doesn't take a lot of time, and I don't go into, a lot of detail about it, but usually the pictures speak for themselves and the x-rays speak for themselves. And when they hear that, those perio numbers like being called out, they're like, oh.
They knew, because you prepped them ahead of time.
Mm-hmm.
If you hear this, then yeah.
And that's the other thing too, is I always try to I'm constantly kind of talking as I'm working, so that I'm not spending so much time not doing anything and just like trying to talk the patient into something. Like it's just kind of always moving in motion. And
I think that patients appreciate that too. Like if I understand what's going on, like you're up in somebody's mouth, like you're in a very intimate setting. Like if I understand what's going on, like I'm going to be more open to whatever treatment we need to do to get it to where it needs to be, versus, they haven't said a single word. I had no inclination that anything was bad, and now all of a sudden I need an extra $3,000 of treatment or whatever it is, like that doesn't. I've had that happen before, and I haven't seen that dentist again.
Right. Yeah. You've been on the other side of what it feels like when it's like silence, and then, oh, by the way, you have periodontal infection here. It's like, wait, what happened?
Yeah.
And yeah, that's such a beautiful point. You pinpointed those patients earlier, so you knew. We talked to Fred about those areas. We were really concerned. You got everything ready. You got in there, you did your assessment. He was ready for, if you hear these numbers, we've got something going on. So the patient's mind was kind of already prepped. And, one thing that I've heard is like, well, in my state, we have to diagnose perio. No problem. That's okay. But still, if they're doing that first 20-minute assessment, if the doctor can get in there, they can still be getting the treatment plan ready, get them all ready. If that doctor can come in anytime during that and just say, yes, I totally have faith that, Amy is right on. I looked at your x-rays, spot on, totally. She's going to take great care of you. If that's what's needed, that's fine. In our state, we're fortunate we have, as you know, Ash, like that flexibility to kind of ensure our hygienists are doing the right thing. But one thing I will say that I feel like Amy, I don't know if it was said too quickly, but I want to make sure people know, is you can't have that level of faith and trust, I think, in your hygienist if you never set the protocol to start with. So it is important. And, all of our hygienists, both offices, like they follow the same perio protocol. So that when I was telling Amy at one point, like, it doesn't matter if a patient goes between, she knows, Kylie and Avon is going to do the same thing as here. And so I think that's one part too, that if you haven't ever sat down and really defined for your hygienist what that protocol should be, you're kind of leaving them in a position where they don't know. And I think that's a ceiling that Amy's really broke through, is like being able to have that conversation really confidently of, I'm going to get you healthy, but this is what it's going to take. But I think it starts with her knowing really very specifically the guidelines of what's expected, what's health for the patients, and what's disease. I think that's something that she kind of said quickly, that I'm like, it's a really big pivotal role in making sure that the doctor is part of ensuring they feel comfortable with the perio protocols of the practice.
And did you help establish those protocols, Amy?
Yeah.
Yeah. So like when you have someone, it's when you're putting kind of your skin in the game, and you're like, here's what I'm thinking, and you have that kind of collaboration and teamwork, then it's going to be easier for someone to stick to, versus the doctor saying like, here's the protocol, I don't care what you think. And you're like, but I don't necessarily agree. I'm the one that looks at the gums all day. Like,
well, it just makes perfect sense, because for so many years I practiced, and it was like, well, this patient has this, what am I going to do here? And it's like, it can be so straightforward and so streamlined that if it's this, and this, like it's a no-brainer. And now it's just so much easier to just like know exactly where we're going to go with each of these. And even in like open dental, we've made little like the multi-code where like you can quickly like treatment plan a full mouth, like periotherapy, and it's got the laser in it, it's got the fluoride at the end, it's got, it's just got all of those things in there. So we're just trying to make it to where we can push the easy button as often as possible and and just not have to like recreate things every time something comes up, because that's what I used to do. And then I would not do it. I would do a bloody prophy because I didn't want to take the time.
That was easier. Bloody prophy was easier than the.
It was. And then I would be like, oh, we'll check it again next time. And then they bled again next time. So it's like,
Weird.
Right.
I mean, here's the thing is like, I feel like, thank you for being so transparent. Cause I'm like, I think that we can kind of guise our lack of really good, treatment planning and periodontal health. We can guise it with like all sorts of like, well, it's because I'm trying to be really conservative, or when really, when it comes down to it, we may be just, if I can be so bold to say, like, we just weren't maybe quite as prepared and intentional and, equipped, I think, even with providing the care with the easy button. So we just don't do it. Because I don't know about you, if something's not relatively easy, I don't want to do it. So a huge tip for doctors is like, spend the time on the front end, just like everything, to ensure that all of this is shored up so that your hygienist can do these things easily. Because if it's really hard for them to implement, it's just human nature. Like, we want to take the path of least resistance. So I love that you said that, because it was true, and we had like, I don't know, 12% perio or whatever. I don't remember.
Right.
So
hey, I was telling them they were bleeding.
you were. Well, and I was coming in and being like, I don't know, sure. I don't know. So it's me, Amy, for sure. It had to start with me. So, but yeah, so, knowing that like, you've done all the prep work, you've identified kind of adjunctive things, for Amy, like you guys will see when we post kind of her end of day sheets, she always has what her day started at. All the hygienists do. So they'll say my day's starting at 14:27. And then it says projected goal. Like, what does she see she can add to get herself to kind of where she knows she needs to be to maintain kind of her own goal for that day. Knowing Amy, sometimes you'll see, I know, I've seen it in the morning huddle. She'll be like, hey guys, I'm literally at 1300. What's amazing is it just happened, and I'm not kidding, like yesterday, 1320 something, and she really was at like 2016 by the end of the day. Like, knowing that, Amy, like, what are some of the top 3 adjunctive things that if doctors are sitting right there and they're saying to themselves, like, what could I help my hygienists learn to do? Or if hygienists are listening, what are some things that are the easiest adjunctives that you've now found are the most effective, the most helpful, and the easiest to actually implement?
I think the biggest one or the easiest one is fluoride, and not just for children, but for our adult patients. It's good for so many reasons, and if you believe in its value, I think it's a really easy thing to add to patients that have invested in dental work, patients that have recession, patients that have sensitivity, patients that have had recent cavities, or patients that just want to keep their mouth healthy. Like, pretty much everybody could benefit from fluoride. So I feel like that one has been
Patients who have mouths.
Yeah, pretty much. And I would say we live in a state where there's a lot of people that don't like fluoride for whatever reason. So, we do have some that say no, but I think we're at like over 90% acceptance rate on our fluoride across the board. That's not just kids, that's our adult patients too. And I think we have 1 or 2 insurances that actually cover adult fluoride. So it's a quick conversation, like, hey, Susie, I'm seeing these areas of recession, and I know you've been experiencing some sensitivity. I would recommend a fluoride treatment today. It just takes a minute at the end of the appointment. Your dental insurance isn't going to cover it, but it's only $35. And they say yes, usually, unless they have a aversion to fluoride for whatever reason. But one thing, doctors, that I will say is if you even take a second to say at the end of the exam, like, yeah, and I do recommend a fluoride treatment when you're here just to help protect your investment. It goes so far, even for the patients that have told us no, or maybe they did it last time, so they're like, I don't need it this time. But just getting that little blessing from the doctor, it goes a long ways. So fluoride, I think, is a huge one. That one's such an easy one to add. And truly, I think I just didn't offer it in the past because it wasn't covered by insurance. It wasn't easy, and I was uncomfortable having that conversation, even though I believe in it and I think it's important. And then the other one that I think is really easy is the laser bacterial reduction. Pretty much anybody that is getting a little bit of bleeding, even if they're healthy, while you're cleaning their teeth, like that's a super easy one that you can just add. It takes 5 minutes to do the whole mouth, not even 5 minutes. I mean, it's pretty quick. And people love the technology, you know, if you just give them a little, like, this really does stimulate healing and it just kills more bacteria than what we can do with our instrumentation alone. Like, real quick, simple verbiage, like you don't have to go into great detail, but that's an easy one to add. And then another one that, you know, just the standard in our practice is to take PAs of any teeth that have had endo or implants at least annually to really check those spots. And what I usually will do is if they're having their 4 bite wings and their anterior periapical x-rays one visit, I'll save the like implant and endo PAs for the other visit. And again, that's where we go back to the breakdown of the insurance. You can have that conversation of, you know, doctor would like to, you know, see if there's anything going on around that root canal or whatever. We just haven't seen it, or I don't know. Like, I think some patients it ends up being a couple years, you know, but usually if you take them annually, that's what our doctors like. But that's a really easy one to add. The conversation, like for those anterior PAs with the bite wings, a lot of insurances will cover those PAs, and it doesn't make a difference with the FMX frequency or anything like that. But some, they don't cover them. They'll have like a 20% copay and they'll have to pay their deductible. I have found most patients are like, as long as you tell them on the front end, like, hey, your insurance covers the x-rays on your back teeth, but not on your front teeth. I would recommend that we check those as well. I think your portion will probably be around $40 if we do them. Is that okay? Most of them say yes. I just had a patient like last week that she's told me no on these anterior x-rays. And 27 had this really weird, like pinkish hue to it. And I was just like, Nancy, I think this looks suspicious. Can I please take an x-ray of that area? She had like internal resorption and now has to have like a root canal. And I think her FMX was like 2 years ago or 3 years ago. So in that small amount of time, she had this progression to where, you know, so now I just feel even more convicted that like these need to be done. It's not overkill. It's not overselling. It's actually like just making sure that we're taking care of our patients. Yeah. So I think fluoride, laser bacterial reduction, and PAs, whether it be with the 4 bite wings when they're due for those, or endo PAs and implant PAs annually. Yeah, I think those are huge ones. And we go back to that insurance breakdown again. Like, we have to have that information so that we can have the conversation, so that the patient doesn't come back mad when insurance doesn't cover them or whatever.
Mm-hmm. Well, and one thing that I will say, Ash, is like, if you didn't notice, because she's so well prepped, she's so confident going into those patients, she can have that conversation with them. I hear a lot of times hygienists be like, well, I'll just wait for the treatment coordinator to come in and tell them that they owe money for the PA. Well, you've just, like, Amy, could you imagine if every time you did that, how much time you would spend waiting for our treatment coordinators? Mm-hmm. You know, the nice thing is, like, Amy's so well prepped, so confident in what she needs to do and why the value is there for the patient. She can explain that, hey, listen, even if your insurance doesn't happen to cover it, I strongly recommend it because of this, this, and this. It's going to be about $37, you know, or $40 or whatever. You know, she's not having to sit there and wait to get the okay from, you know, the higher some, you know, up somewhere. Like, she's coming in prepped, she's coming in having those conversations. And, you know, the thing I love about our hygiene team is, one, I mean, I feel like I really want them to be nurse practitioners from the mouth. You know, I want them, as I say, like, to go in and like they have full autonomy and ownership over their domain. Like, they're little intrapreneurs, I like to say, like within the practice. Like, you know, I want them to have that latitude, but then I expect a lot. Like, if you're going to go in, like, then you're going to get your patients healthy and tell me how you're going to do that. And then let's give you the resources, the tools, what you need. But, you know, that is kind of that level of expectation. And I think, you know, it doesn't matter. We have a brand new one over, I mean, Amy, the other Amy in the other practice, is brand new. She's already doing really amazing, I think, numbers just because of, like, here's the baseline of what we set, here's the protocols of what we do. These hygienists have taken her under their wing and say, this is how we do things here. Like, it does make a huge difference in, you know, when you've kind of spent all that time on the forefront of ensuring that these hygienists have all the tools and resources to be these, like I said, nurse practitioners of the mouth. It's amazing what they can do. They can not just be profit centers, they can be like literally co-collaborators in the offices with you. So
well, I think it goes back to kind of any position, right? And that's kind of, you know, with regards to any position, people want to be good at their job and do the best that they can. And so, you know, and sometimes that means needing to have tools and knowledge. And so if you're empowering like a new hygienist to come in by like, hey, we're literally, you know, here's how, giving you the options, or not the options, but you're showing them, here's what it looks like if you're successful in this position. Here's what our other hygienists are doing. You know, that's going to give them the confidence then to really own that. Like, you know, we're saying, you know, they want to do well. They want to do well for you, for their patients, for the practice. You know, people want to do good at their jobs.
Yeah, absolutely. Well, and Amy, you know, we kind of dissected the first 20 minutes of a 60-minute recall is that assessment, assessing periodontal, all the stuff. Middle part of the appointment, the second 20 minutes is really when you're kind of going in and doing the prophy, or if you need to, you'll often add like a 1 to 3 teeth scaling and root planing in addition. The last 20 minutes, you know, at some point the doctor's exam is coming in to kind of tell us kind of how we use exam cards to help create a checklist for you guys as hygienists to ensure that everything's getting done, and to almost start to warm up and do a kind of preliminary handoff before the doctor ever even walks in.
Yeah. I think we came up with these exam sheets because we were doing all this legwork, and then the doctor would come in and ask the exact same questions, and, you know, I'd be like, oh my gosh, I already have all this information for you. Like, you don't have to ask this again. And so what we do is we have these little laminated sheets that during the assessment, I'm just gonna, as I'm doing my assessment, we have them laminated, and we use a little dry erase marker. I just jot down different things. This one we changed up a little.
Thank you, Anna.
We're trying to make them easier as time goes on. But anyways, I'll go through and I'll say that I think I already mentioned this, like, has the patient met the doctor? Yes or no? Yes or no. So then the doctor knows, like, I don't need to introduce myself. I already know this patient. Did we take x-rays? Yes or no? And then the doctor knows, like, before they even come in and start like talking to the patient, they're going to look at the x-rays and kind of get an idea of what is going on. We also have like the chief complaint on there. Like, we don't want to, you know, not pay attention to what the patient wants to talk about today.
Right.
Then also an area for oral cancer screening concerns. Like, did we see anything that we want doctor to check? Hard tissue concerns, soft tissue concerns. Do they have missing teeth? Have we ever talked to them about replacing them? Any aesthetic concerns that the patient wants to kind of talk about, or occlusal concerns. So like, those are all on there. So every visit, you know, we don't have to like go into detail. Like, if we did it last time and the patient said like, I'm not going to wear a guard, we're not going to, like, you know, like, we're going to tell them we're concerned about the wear, but we're not going to, you know, keep trying to beat that one. But I think it has saved a lot of time, because the doctor comes in, kind of knows where we've already preheated the patient, like where we've already teed up like treatment that we've been maybe monitoring. We took new intraoral photos. Like, then the doctor can come in and just basically bless what we've already kind of set them up for.
Yeah. And I think the nicest thing for us is, and like Amy can attest, like, you know, I think she's now done exams of like 7 different doctors within our offices. And, you know, you think about it, like the goal being that that doctor can walk into any hygienist, and any hygienist can really work with any doctor, and the same criteria are going to be met every time. That doctor is going to know after the 20-minute assessment, here's all the things they went through. And, you know, Amy did a beautiful job of turning everything mostly into yes or no, circles of yes and no. Yes, I've done this. No, I haven't. Yes, you've done this. No, I haven't. You know, and then because it's, you know, a little dry erase thing, she can write a little note of, you know, we discussed missing teeth. Yes, really interested in an implant number 19. So the doctor, you know, we walk behind them and, you know, usually they're working, you know, while they're, you know, after they've called us for that assessment, we can walk in, pick this up, and before we ever walk in, literally look through it. And it's literally like a handoff before the handoff. And so a lot of that exchange of information, you want a lot of it in front of the patient, but sometimes you don't want all of it. Like Amy said, we literally have had doctors who were like, hey, I'm Dr. Melanie, nice to meet you. And they're like, I saw you 3 weeks ago. Like, and it was that awkward, was it not? Like, so, you know, this makes it to where some of that awkwardness, some of that, like maybe things that don't need to be said can actually be done behind the scenes. And then Amy, kind of talk us through from your point of view, what makes a really beautiful doctor handoff? Once you've done all this legwork, they've looked at all of this stuff on this exam card, what makes a really beautiful doctor handoff?
I think just the thing that hygienists love the most, I think, is when the doctor can be talking to the patient and talking to us about what's going on in their mouth while they're actually doing the exam. So we're not wasting any time. You know, we don't have a lot of time. So like, I love how when they come in, they'll be like, so Amy, tell me about soft tissue, tell me about hard tissue. And I just kind of go over everything that I've already kind of gone over with the patient. And it's like they're hearing it again. And they basically just either say, yes, I think we need to do a crown on number 15, or, you know, let's get you scheduled for that consult with Dr. Casmel to go over the bite, or, you know, there's just so many ways we can go, but
yeah. Well, and it's funny, a friend of mine actually popped up a question of like, where do we put those laminated sheets? So the hygienist is sitting there kind of working on that laminated sheet. Where do they put it so that the patient doesn't see the doctor like walk in and be like, hey, grab the sheet? Like,
we have side cabinets. And so the patient's like over here. So I usually, after I call for exam, I'll put it kind of back on the counter so the doctor can grab it discreetly without making their presence known.
Right.
If they don't want the patient to know they're there yet.
Mm-hmm. Yeah.
So if you pre-plan like where you want it, yeah, we do try to not make it super. But I do tell the patient like, hey, I'm just making some notes, you know, for doctor about what we're talking about or what I'm seeing. Mm-hmm. So when the doctor comes in and already kind of has an idea of what's going on, the patient's not like, wait, how? Like,
how do they know that? Yeah.
Telepathy. And that's just, I mean, that is the nice thing is, you know, the doctor can then walk in, they have a good idea of what happened, and it can be, you know, hey, Bob, how are you? How are things going? You know, a few things of small talk. The one thing I will say is sometimes I see doctors who, like, you know, especially if you're in a small town or you know your patients really well, sometimes you have to engage in that small talk. But I know for hygienists, from their point of view, engaging in it for 27 minutes is really tough. And so I think if it's your fishing buddy, it's really important to be like, Bob, so great to see you. Can't wait to go fishing with you or see you at the kids' game on Saturday. I'm going to go ahead and dive in. Not using that time, because we've had some doctors that really love to talk about the bait on their lures, or, you know, or whatever it's called. I don't know. And let it go, Ashley. But you know, it's so hard because the hygienist is sitting there thinking like, I've got a timeline going. So I think going in, making that small talk, but then diving directly into like, okay, Amy, let's talk about soft tissue first. At that same time as Amy's getting ready to talk about soft tissue, being in the mouth while she's talking about it. So kind of as she's walking through that exam, the doctor's looking at soft tissue, hard tissue, occlusion, missing teeth, all the things as she's doing it. So she's reiterating what she told the patient, what she wrote on that exam sheet, and while the doctor's in the mouth. So the patient's getting to hear some of those key points multiple times. Amy, one of the things you touched on that doctors ask me a lot is like, one, how do I teach my hygienist to help tee up treatment? How do I, like, my hygienists always feel like they're selling things, or they feel like they're having to be pushed to sell things. Tell me how you got over, what was the mind shift for you for selling things and like feeling like you have to tee things up for selling?
Gosh, I think it's just easier if I'm the one doing the assessment and taking those intraoral photos and taking the time to go over those with the patient. Like, I'm not diagnosing what they need. I'm just telling them what normally would be recommended in those situations and what would make them healthy. Like, I don't feel like I'm selling dentistry. I feel like I'm just telling the patient what they need. And then just asking those questions. Like, I think sometimes we miss opportunities when we don't bring up shifting teeth or wear, or I'm trying to think, like the missing tooth, like.
That's what I was gonna say, that example you just gave of like, that was way faster than you would have expected. So it's, it's important to kind of keep an eye on these things, right?
But I don't know. I guess the thing that I love about our practice is we collaborate so much with the dentists. They tell us, if you see this, if the filling is 50% or more of the tooth structure above the gum line, I'm probably going to recommend a crown. A diagnodent reading above this, I'm going to recommend a filling. You know what I mean? Like, we have these baselines of what's going to be recommended, and we meet, we collaborate, and it's like this. It's just I don't know. Like, we are working together. They are putting us in the position to like really help educate our patients. So I think as hygienists and the nurse practitioners of the mouth, like, we aren't just supposed to talk about like perio. Like, there's so much more to their overall oral health that we need to be having those conversations. And I don't feel like it's selling. I don't know, but
right,
it's
right. And that's just it, is like, I hear all the time is like, well, how do I get my hygienist to do this? And I think it does start with igniting their passion for getting patients healthy. Because I think often they feel like they're selling if they don't understand so fully the why behind what they're doing. Like, if you're seeing those bleeding pockets, that's infection. We all know now, like, the link of bacteria in the oral cavity to what it does throughout the whole rest of the body. And I think, like, giving those tools and resources of learning together with your hygienist. I mean, I've gone to so many things with her, CE and things like that, where we both sat and went, oh my gosh, what a shift. We've got to start getting our patients healthy like this. Like, I think the passion level for truly giving your patients the best care, you give hygienists the opportunities, the tools, the CE, they get excited about it. And so that's what I've seen is, I don't sit here and beg Amy to get the patients healthy. I don't tell her, well, why didn't you do this or that? She's excited, and really all of our hygiene team is excited about getting those patients healthy and going down that list and not just looking at the periodontium. They like looking and being able to co-diagnose almost, or whatever you may want to call it. Co-discover, I think, is a better word with the patient. I feel like the D word can get people a little worked up. So I'll say co-discover instead, that D word. But they get to discover with the patients what's going on, and they are really their healthcare advocates, I find. Like, turning these amazingly brilliant humans into like truly advocates for the patient. The doctor can come in and spend so much less time.
Yeah.
And I think for hygienists, a lot of times, that's what means more than anything to them, is they're educating their patient. They're giving them great care. When the doctor comes in, it makes the exam so much quicker. If that exam card's been done, the handoff is really effective. The patient gets to hear again what's going on. and we're not having to say, did you take any intraoral photos? Did you go through anything with the patient? Okay, well, now I'll go through everything. Right, Amy?
Yeah.
Like that used to
What a
happen.
great experience for the patient, right? Because then it literally just flows down. They're in the chair for less time. They feel like their team around them are confident and cohesive, and it's not.
Yeah.
I think it just trickles down, and that confidence and that it just is felt directly by the patients as well.
Yeah.
Well, and the streamlining of like the 20-minute assessment, 20-minute instrumentation, that last 20 minutes, can be catching up if maybe you went into your next 20 minutes of like finishing the cleaning or whatever. But after the doctor leaves, I can put the treatment plan in. I can, the doctor kind of sets the tone for like how soon they want them to be back and how long they need to be scheduled for. I put that in the treatment plan. I send a note up to the front. They kind of compile that treatment plan. They get it all ready. So I'm finishing up the appointment, putting their fluoride on, and then I'm scheduling their next recall, and then just kind of reviewing what we found in today's visit, and then I'm taking them up to the front, or the front's coming back to go over the treatment plan. Kind of depends on where we're at in that hour. We always try to stay in the room for the treatment plan if possible, but that doesn't always happen. But we have found that once the patient gets up and is going out, like they're going out the door. So the more you can do in that operatory, I think the better. And that's where getting the doctor in and out, you have more time on that in that last 20 minutes to wrap everything up. And like I said, get that treatment plan kind of gathered. The front can make sure that it's correct, print it out, or bring the pad, the
tablet, whatever they're called,
to sign. Yeah, and then we are scheduling our hygiene patients back for their 3-month, 6-month scaling, whatever. We're trying to do that from our room, and that's kind of that last 20 minutes. So
yeah. I get the question, by the way, often, Amy, and I don't know if you've ever gotten this as a hygienist, of like, well, do you try to always reschedule them back into, do you try to get them to reappoint? And, I think the answer is yes, of course. But one thing I will say is, like, we have found if you're like just pushing them into an appointment, they're like, well, I don't know where I'm going to be. Well, just take the appointment. You can cancel it later. We found that it gives us a false sense of security. We'll look at that 6 months later and be like, it's totally full. But 10% of those patients are going to drop off because they're going to get the text reminder and they're going to drop off anyway. So I know for our hygienists, they definitely try to, give them an appointment and just say that if you want your time, if you want that certain day, I know you love that. Your schedule is going to probably be about the same. We'll get you scheduled. And the one thing I will say is Amy's really good. The whole hygiene team is good about saying, we need to get you back. It's really important you keep that appointment because of that perio pocket that I just treated, that area of recession that I'm really worried about. They give them a reason to understand what the big value is.
Why, right? That why is so critical.
Yeah, for sure. So, I mean, I think, for everybody, I would say the prep is the biggest, starting with the first phone call, insurance breakdown, the hygienist really spending the time 2 days before, the night before, looking at their schedule, really taking the time to know their patients, know their needs, what they need to get healthy, knowing what adjunctives they may add, including a 1 to 3 teeth, having that ready with the treatment plan so that if that's going to happen in that appointment, you're ready for it. Really timing your appointments to ensure you're being effective. So for you, it's the 20-20-20 rule, using that first 20 minutes to thoroughly assess everything, perio-wise, teeth-wise, oral cancer, everything. And then using hygiene cards, exam cards to ensure that that transfer of information is done as effectively as possible. I think that those are all hopefully some really good tools. We'll post them as well for people to use, but to kind of wrap everything up, Aim, like for hygienists that might be sitting there, whether they're 1 year out or they're like you, they've done this for more than 20 years, what are some ceilings that you used to think were there that you would be like, it's never going to work. It's not going to work. I can't do that. What are things in the last few years that you have seen have allowed you to continue to grow, not just your personal income, but your impact and influence on patients?
gosh, I don't know.
like time wise, do you feel like?
Yes. Well, if even 5 years ago, I probably would have fell over and said, there's no way I can fit all of that into an hour recall visit. Like, you know, I use 61 minutes of a 60-minute appointment. I definitely use it. And that's where I'm always like, oh my gosh, how is that hygienist already finished? Like, she's only been with the patient for 20 minutes. How did they already let that patient go? Like, I think just figuring out how to be super thorough. Like, I feel like I'm providing such good care to the patients. And I've become more and more efficient. I'm doing more in that hour than ever before. Like, gosh, even the iTero scanning, like when I first tried to do that, it was like a 20-minute scan and it wasn't even very good. Like, poor Brittany would have to like redo it. But now I'm like down to like 3 minutes. So I can fit that in, you know, we can do those scans easily in that hour. You know, I can fit that in. There's so many ways that you can add to those appointments. I talked about the 3 top ones, but like, we do a lot of Invisalign in our practice, and you know, those retainers need to be redone every so often. So like, that's a quick, like, I can scan for new retainers. That goes on my day. We have like a 20-minute in-office whitening, you know, that you can add really easily if you have an extra chair, and maybe like, if it's the same day ad, you can have the assistant kind of help you if they're available. Gosh, impressions for whitening trays, for in-house like NTIs. Yeah, there's just, the sky's the limit. And no matter what in your practice, like if you don't use lasers, maybe implement Arrestin or, you know, something adjunctively to the scaling and root planing.
Yeah.
I don't know. I find it it's just been kind of a fun challenge, like every day. Like, I'm like, oh, okay, let's see how we can get there. And I don't know. I feel like it's just, I don't feel like I'm selling things that aren't needed. I'm just,
Awesome. Ash, can you think of anything that maybe you've heard that we didn't cover? You hear a lot of these things too. I'm sure we'll get probably all the questions later, but
yeah, I'm actually thinking, I'm like, I feel like we need to have Amy back at some point, because it's just such a, I think, you know, there's a lot of opportunity just for patient care in general. And I think, like you said, just getting hygienists to understand that, and even docs, you know, just like getting everyone on the same page. The fact that you mentioned how important it is to bring your culture together to understand what the goals are. And that I love what you say, that you're like, I don't feel like I'm selling treatment. Like, this is healthcare, you know, and this is what they need. But you know, I think that there's probably some more tips and systems that we can discuss here as well. It actually kind of makes me really excited. So we're going to come back for part 2, I think.
I think that's a great idea. There's so much, isn't there?
So much.
I know. Well, I'll be logging all the questions I get. You let me know the ones you might see, and we'll bring Amy back for hygiene part 2. What I would say, if anybody listens to this and you do have these questions, just direct message me. It is really helpful. Post it in the ladies group if it's hygiene stuff. Because I mean, truly, I feel like Amy has kind of overcome every hurdle that I've seen hygienists tend to have, whether it be time or the doctor or the resources or whatever. Like, she takes so much ownership, and I think that's probably the key word to end on. Like, she has such ownership over her patients, over her domain, over really like what she does, that it really, I think, makes everybody around her better for sure. So
I think that's actually one of the biggest things I have is like, I want to know more about this mentality you have around these things, and how can we, you know, communicate that to our docs who are listening and office managers who are listening, that type of thing, to help empower their hygienists. You know, how do you, so ponder that and meditate on that, because like I said, part 2 is happening.
Right, because just like I'm going to get a text of like, where did you find your Andrea? Where did you find your Debbie? Where did you find your Amy? I'm always like, you do know, just like everybody, like we all grew together, you know what I mean? And I think it's so much of like cultivating that ownership culture, you know? So, gosh, part 2 of ownership culture within the hygiene team, right?
For sure. Well, thank you ladies so much. Amy, thank you for joining us. And Dr. Summer, we'll be seeing you soon.
I know. So I'll see you real soon, actually. So yeah. All right. Talk to you later. Thanks, everybody.
Bye.
Bye, guys.
Bye-bye.
Thank you.